So now actually I'm going to ask Frank Moore to come up, who is not Ellen, as you probably can tell. So Ellen Franklin is the chair of our Community Advisory Council, and she has that horrible bug that's going around, and called this morning and said, there's no way I can make it. Could you have Frank fill in? So Frank, who is on our Community Advisory Council as well as the Linn County Public Health, is going to give us an update on the Community Advisory Council.
Thanks, Kelly. Well, first off, as Kim's noted in her speech, her opening, that there's a lot that goes into changing healthcare, and particularly in our region. And so the CCO has served as a catalyst to do that, and has basically created a structure. And as that then translates into the pilots and how we go about changing healthcare. So the other aspect of it, which I've been very involved in, has to do with the Community Advisory Council. And in fact, there isn't just one Community Advisory Council. There's a regional Community Advisory Council, but there's also a local advisory council in each of the 3 counties. That's what kind of gives us the traction in the community, and that's made up of roughly 60 to 80 people who spent the last 2 or 3 years working on the Community Health Improvement Plan. Could I have just the Community Advisory Council members at the regional level just raise your hand? So we know we've got at least 4 or 5, 6 of them in the room, and then the local advisory council members. So you can see that there's, thanks, Stretch. So you can see, and some of us are not meek about giving our information, right, Stretch? Okay. And I think that's part of what makes this a very unique group, in that, and as Kim was saying, it shouldn't make a difference where you access services in the IHN region, whether it's in Linn County, Lincoln County, or Benton County. Shouldn't make a difference if there's a river between us, that whatever you get on one side of the river is the same kind of service, the same kind of access, the same quality of care on the other side. And I think part of how the Community Advisory Councils help ensure that is they act as a connection to the community, and we meet on a monthly basis. The Community Advisory Council at a regional level created the Community Health Improvement Plan and submitted that to the CCO in 2014, to the CCO Governing Board in 2014. We have since amended it or provided an addendum last year, and we're in the process now of working on it, even refining it even more. As Kim said, there are now 5 health impact areas. That's access to care, behavioral health, chronic disease, maternal health, and child health. And we've basically broken that into different areas where we're looking for measurements and the ability to at least establish measurements so that we can show progress, and the CCO can show progress over time in each of those particular areas. All of that information is available and will be on the CCO website, so I invite you to go take a look at it at some point. What I can say is that what's really cool about how this has come about has been Samaritan and IHN's focus on the collective impact model, where basically everybody comes to the table. As you heard a number of invites from Kim earlier, if you want to be part of it, come help us with that. And as part of the local groups, the Regional Community Advisory Council meets every other month on I believe it's the 2nd Monday of the month, and we rotate that amongst the 3 counties. There's other meetings that you're more than welcome to attend. In Benton County, the group meets from 10:30 to 1:30 on the last Friday of every month. In Linn County, the group meets the 2nd and 4th Thursdays. And in Lincoln County, it meets the 1st Wednesday of every month. And we can get information to you if you want to come and join us. The groups grow from, change from size to size, but people are very attuned to the CHIP and the health impact areas that we've been working on, and I literally have put in hundreds of hours into putting that together over the last couple of years. With that, I think that pretty much covers it, but we are in the process of beginning to take a look with the Community Advisory Council on community engagement and how we can be an ear for the CCO and give people an opportunity in a friendly environment in each of the local groups to come and talk about what's most important to them about their health care in this region. So that, thank you.
All right. Oh, Frank gets a clap. So as a reminder, Ellen wanted me to make sure everybody knew that on the tables are these self or prepaid envelopes, and they say Intercommunity Health Network, become involved in our Community Advisory Council. So if you are interested, these are out there, and you could certainly fill those out, and we would love to get that information from you, and we can connect with you if that's needed. So, yeah. He's recruiting.
So if anyone's interested, again, the information and the forms are on your tables. I'd be happy to talk to you. We're looking for people.
Excellent. All right, are there any other questions so far on some of this information we've shared? We can certainly, if you have additional questions, please fill out the yellow forms, and we'll come around and collect those so we can make sure we answer them, but you can also ask as we talk as well.